reaching their arm through a door hatch to enable contact with their parents during a visit to one of these facilities. Let's talk now to Alexis Quinn. She has autism. She was detained for 3.5 years in various mental health facilities. She's co-authored the petition that's going to be handed into Downing Street today, and she's also written a book called Unbroken. Also with us, Jane Harris from the National Autistic Society. They co-authored the petition too. And Barbara Keeley, Labour's Shadow Mental Health and Social Care Minister. Welcome, all of you. Alexis, remind us how you were detained and what that was like.
Well, I went into crisis a few years ago. My brother sadly passed away, and I had a baby at roughly the same time. And all of that change, in routine and structure, meant that I was just unable to cope in the community. And at the moment, it's a sink or swim situation. You either manage or you don't. And because I wasn't managing, I did ask for help. And it wasn't forthcoming. There was nothing in the community for me. And so that meant that I ended up being put into a psychiatric hospital for people with mental health problems.
Is autism a mental health problem?
It isn't a mental health problem.
Why were you detained in a mental health psychiatric unit then?
Because at the moment, autism is considered a disorder, and it comes under, the Mental Health Act, and it's in the DSM. And so at the moment, the policy is such that people with autism, which isn't treatable, it isn't curable, people are being treated, wrongly in hospitals that are designed to help people and to treat them.
What was your experience of being detained for that in various facilities over 3.5 years?
Well, some of it was good, but a lot of it was really bad and has really traumatised me. As soon as those doors lock, as soon as you walk through those doors, it has a psychological impact. And for people with autism, we need routine, structure, predictability, familiarity. And we get that at home. You don't get that in a hospital. What you get is a sensory charged environment, you get chaos, and you're out of the context that you actually want to be functioning in and adapting to in the community.
And you escaped in the end. This is extraordinary.
That's right.
To get out, you had to escape.
That's absolutely right. I was locked in. I was put into cages. I was kept in seclusion rooms for hours and hours. I was long-term segregated, fed on the floor, in very unstimulating environments. And it came to the point where I had no choice but to make that decision one morning that I had to leave the country. And fortunately, I had the resources and was able to do that. But I know that so many people aren't and aren't, and can't do that. And that's not, we shouldn't be in that situation, Victoria.
So some people might be sceptical that you were held in a cage. Just describe it.
Well, it looked like what you would impound a dog in. And I was kept in there for a good few hours, being transported between hospitals.
Right.
And you have to wait. If you think, people at home, you have to wait for a nurse to bring something to you at your bedside. You have to wait in mental health hospitals as well. And so that meant for me waiting in a cage.
You're laughing with hysteria because it's absolutely not funny. Let me bring in Jane from the. I've made an assumption it's hysteria, but do you know what I mean? It's so absurd, Alexis.
Shocking,
yeah, it really is. Jane, how bad is this problem?
It's horrendous. We know at the moment there's over 1,000 autistic people in mental health units. A third of them professionals have said that they do not need to be there. And what we need to change is we need to have more community services, both mental health services that understand autism, that can give people help before they get to crisis point. We also need more funding for local councils so they can provide social care support, help in the community. But we also need a change in the law. And that's why we are going with Alexis today to Downing Street, because at the moment you can be sectioned and detained in hospital purely for being autistic. You don't have to have a mental health problem as well as being autistic. You certainly don't have to have a mental health problem that requires inpatient treatment. And that is wrong, and we really want the government to review this and put in place a better law.
Barbara Keeley, Labour's Shadow Mental Health and Social Care Minister. A change in the law will do what to protect people with autism?
Exclude autism from the Mental Health Act so that somebody like Alexis couldn't have been detained. And Jane's quite right, there are over 1,000 1,150 autistic people, but including children. There are children in the same situation
Yeah,
as Alexis.
and we've reported on that as well.
It's tragic. It's absolutely tragic, and this has to stop. I raised this on the last day of Parliament before the recess with the Minister, because we had a debate on the Mental Health Act, and said autism should not be included. People are not being treated.
Is there anyone who disagrees that autism shouldn't be included?
The government hasn't dealt with it. The government hasn't done anything about it. So
It doesn't mean
clearly they've got their own reservations. I asked the Minister, I couldn't shift her on it. So
Right.
having the petition is actually the right thing to do. We need to keep on raising this, to keep on keeping this off the agenda. It's very, very important.
You estimate the fact that you were detained in various places over that 3.5-year period cost how much to the taxpayer?
I think, because a bed costs between £700 and £1,400 a night, I think about £2.5 million.
Which is absolutely extraordinary.
It is, considering all I really needed was some occupational therapy to manage my sensory needs and routine and structure issues, and some psychology specific to autism to deal with the bereavement of my brother.
Could it happen to you again?
Yes, and in fact, one of the triggers was that I was pregnant at the time that I went into this crisis because of the routine changes that come with pregnancy. And I'm pregnant again now, and so I'm really concerned, and so I'm really grateful to the Autistic Society and people like Barbara Keeley, who are bringing this to the government, because we've really got to do something.
You've brought this up, I think, with successive health secretaries / ministers. Is anyone listening?
It doesn't seem like it. We have lots of reviews. There was a summit just the other day discussing all of this. But what we need is action now, because as Jane said, local authorities are cash-strapped. They don't have the funding to put in place the support that people like Alexis needed, and that's what they need to do. We have pledged, Labour has pledged, £350 million a year to fund local authorities in bringing people out of these units and supporting them in the community. So they need accommodation and they need support from care staff. I mean, much needs to be sorted out in social care, but this is a priority, and we're making it a priority. Boris Johnson's throwing money around like confetti at the moment. He's pledging all kinds of things. He could do this tomorrow with a stroke of the pen.
Jane, finally, there was a review into the Mental Health Act, wasn't there, which the government says didn't really come to a clear conclusion. Do you buy that?
Well, no, the review into the Mental Health Act was very wide-ranging, and obviously if you're doing a review into the Mental Health Act, your primary concern is people with mental health problems. But unfortunately, there was a small group looking at this. It didn't include any autistic people. In Scotland, there has been a review specifically on the issue of learning disability and autism in the Mental Health Act, and that's what we need, that deep dive review into this specific issue. Because if you look at the Mental Health Act in general, you don't cover this in detail because it's 1,000 people rather than, the 1 in 4 people who have mental health problems.
Thank you all. Barbara Keeley, if I may, as you are Labour's Shadow Mental Health and Social Care Minister, I want to ask you about the plan that Jeremy Corbyn has put forward today, this offer to become caretaker Prime Minister in a